right. Good evening, everyone. Welcome to our heart health panel discussion tonight. We have with us an amazing panel that is connected to heart health in different ways. They're all experts in what they do, and I'm just very appreciative of everybody joining tonight. So I will start out with introducing our moderator for this evening. We have Miss Dr. Corinne. She is our board chair for Black Women Cultivating Change. She's also the founder of her own foundation, the Empowerment Foundation. And I will turn it over to you. Thank you so much.
Thank you so much, Ashley. I'm super excited to be here. Good evening, everyone. It's so good to see all of your faces. And we are going to go ahead and get started. We're going to kind of jump right in. And I'm going to start with the first question. And I'm going to throw this question to Dr. Angelica Hardy, because I know you do all things heart. And this question is for you. And this is focused around understanding disparities. What are some of the primary factors contributing to the higher rates of heart disease in the Black community compared to other populations?
Yeah, thank you for that question. There are a lot of aspects tied to the disparities with heart health. One that we announced, it was already existed, but data continues to tell us. But we made a statement, I want to say 2021, that we literally had scientific evidence that structural racism specifically is attributed to cardiovascular health, with things like redlining, with health systems and lack of medical mistrust, and all of the things. So we kind of came out with a statement specifically stating that structural racism is a part of that. We know that to be true. We have the data to back it up. And most of the things we then do are working to address those disparities by addressing structural racism in the systems. Well, maybe we're not always addressing it, but providing the training tools, resources that we have that are evidence-based to help combat that. And that's kind of how we've seen it work. We have the data and we know, but there's, of course, the behavioral factors, right? What do we eat every day? How are we transportation and housing and living, right? Social determinants of health. But then there's also just like where you're born and what zip code were you born in. And you are more likely and predetermined based on that. And we know centuries and centuries that plays a huge role. So we try to kind of start at that overarching structural racism and then start to work on addressing the disparities throughout, and then focus on cardiovascular health from there.
Thank you for that. I appreciate that. And I know you mentioned social determinants of health. And I truly believe that social determinants of health play a huge factor amongst all the other things you mentioned as it relates to heart health. So for some of the individuals who may be impacted by social determinants of health, like income and environment, what are some of the things that we could do as a community to really be able to help those individuals overcome some of those social determinants of health to indeed improve their heart health?
Oh, that's a great question. I like that question, because I think the answers are also within us. Like, while I work for this large institution that is doing work for 100 years, I also think that the solutions are within our own communities. And I also think it's myself and others on this call, like the trusted voices and the privilege that we carry, and having the knowledge and the resources, spreading those to our communities and figuring out how we can address our heart health with those. So a lot of times it's, someone talking to me, someone's like, oh, my family member's ready to quit smoking. And they're like, I don't know anybody, but I know Angelica, and I'm going to call her up, and she knows where the resources are to help when they're ready to quit. So smoking cessation resources, right? Or I went to the doctor for the first time and they said hypertension. I have no idea what that is, right? They said it so quick. I don't know what that means. I don't understand what high blood pressure means. It was too quick. I don't understand. Where are those trusted voices, and where is that great information that I'm getting? And how are we bringing that in our community? Yes, I mean, healthy foods as a part of it, a huge part of it. How are we having a seat at the table to provide healthy foods and solutions within our own community? in addition to that, what is activity and what is physical activity? I don't even like using the term physical activity anymore. I call it moving your body, because I truly do not care what it looks like. I don't care if you line dance. I don't care if you jump up and down. I don't care if you like to vacuum clean. Like, I want you to move your body and be active. And gone are the days where I'm saying you have to get on the elliptical for 45 minutes for every day of your life. But how are we figuring out what works for us in our communities, what is sustainable, what can we incorporate in our everyday lives? So really the solution is within us, but it's about us, spreading and scaling the information and really helping to inform our community so they are empowered to then continue to form one another.
Thank you for that. I appreciate that, because I think it's definitely very true of, we have the answers within us, but I also recognize with our community, our community is our community from kind of the things historically that has happened to us. So our eating patterns and some things that we do, it comes from history. So I'm going to pose the next question to Dr. Nicole Mullins. Can you explain the role of systemic racism in healthcare and how it can affect heart health outcomes?
Sure. Thank you for the question. Thank you for having me. I just want to say that this, like a lot of research out there, there's a lot of research that supports the fact that structural racism has caused this divide in healthcare where you have patients that get a certain level of care, a certain degree of care, and then you have other patients that just kind of get left in the background. And we know that we use the term a lot. I use the term a lot. Perhaps you've heard the term culturally competent care. What that means is just being able to have access to a provider who understands what zip code you live in, how that might affect your overall health, and not just in the heart arena, but in a lot of different ways. Whether that's your ability to manage your diabetes well, or if you have high cholesterol, or if you have heart failure. We know that without access to providers who understand your culture, um, the role that it plays, what beliefs you might have, what things might hold you back from coming to seek out care, you oftentimes find patients who are just left with nowhere to go, or when they do seek out care, they don't feel welcome. They don't feel like they have providers who understand them, who understand what they need, or they just don't connect with them because maybe they don't understand what they're saying. It's not being broken down to them in a way that they can understand, or in a way that they can really connect with the information and take it in. So we just have to do a better job. All providers have to do a better job, whether you're a provider of color or not, educating yourself on ways that our bias, our implicit biases affect our ability to provide care to these patients, and just making sure that we are working to understand our patients better. And if we can't, can we seek out or refer patients on? There's nothing wrong with that, referring someone to another provider who they might connect with better, who might understand them better.
Thank you for that. I appreciate that, because I think, looking into history, and I do a lot of things in the maternal health space, and understanding that historically, especially for Black women, I'm not really sure for Black men because my population is Black women, but I know historically they always feel that Black women, we feel pain differently, which may impact the kind of care that we receive. And is it the same for the heart health? Is it, are they just complaining, or they're not strong enough, or they're just making it up? Are those some of the things you see as well, as it relates to maybe issues people are coming into the hospital saying that they feel like, they have this chest pain? So speaking of that, is that something that you feel like, plays a part into this, really not being heard based off of that historical context?
Yes, I do. I hear a lot of people say that they came in, they told their story, they were told that, well, it could be this or it might be that. And a lot of times it comes down to, is it stress? Or maybe that's just a stress reaction, or maybe it is something that has nothing to do with your heart, not really necessarily exploring the possibilities in a way that they might if a patient was not of color. It happens time after time after time. And so, at some point, some patients are persistent and they can keep coming back until they get the answers that they need. And sometimes it just turns people away and they come back in and they're very sick at that point. But yeah, you don't get asked, patients of color, particularly women of color, do not get asked the same questions. They don't get examined in the same way. They don't get the thoroughness that another patient might get. And unfortunately, that is a reality. It may be that, people don't like to accept that, but there's an entire body of research that supports it. So I appreciate, particularly, I'll shout out Dr. Hardy and her organization, the American Heart Association, works hard now. They are working hard to increase, the participation of women in these studies that really sort of looks at that sort of thing. Like, why is that happening? Where is it happening? How can we fix it? How can we pull more women of color in? How can we treat these patients in the same way that we would treat any other patient walking through the door so that everyone has that same health equity, that same access, and they get the care that they need and the time that they need it.
Thank you for that. I really appreciate that. And I do have a follow-up question. However, I got ahead of myself, y'all. I didn't let y'all introduce yourselves to let the people out there know who this amazing panel is. I got ahead of myself, so I'm super sorry. I'm going to pause right here, but I'm going to come back to that question because I have a follow-up question behind it. And I'm going to go on mute and stop my camera. And I'm going to start with Miss Deanna. If you can introduce yourself, say who you are, your background, your experience, and then we'll kind of go to Dr. Mullins and then Dr. Hardy and then Mr. Stewart.
Thank you so much, first and foremost, for hosting and having us on this platform. My name is Deanna G. I am a licensed massage therapist, also a registered nurse. My background with nursing, in particular, when it comes to heart health, has been in the cardiovascular ICUs, telemetry, which for those who may not understand what that means, essentially is floors that are monitoring the heart very closely. And so I'm so grateful to be here and be able to share some of that knowledge of being on the floor nursing, which I currently am not doing, but I'm doing a different modality of nursing in the home, more of home care access. So I'm grateful to be here again. Thanks for having me.
Hello, my name is Dr. Nicole Mullins, and I'm a nurse practitioner. I work at the Christ Hospital in cardiac and thoracic surgery. My background also includes general cardiology. I've been practicing for about 19 years and in that space, and just excited to be here and participate and spread the word, provide any education I can.
And I'm Dr. Angelica Hardy. I serve as Vice President of Community Impact at the American Heart Association, where I lead all of our activations around heart health. So majority of the time that is working within the community to expand and inform around heart health, in addition to working with our clinical entities with training and providing evidence-based practices.
Hello, everyone. My name is Maurice Stewart. I have a small fitness studio called Motown Fitness. So I'm a personal trainer, and have had some personal things with heart things, and would love to discuss that with you also. Looking forward to chatting.
Thank you so much, everyone. I truly appreciate it. You guys are an amazing panel, and forgive me, I'm actually in the library, and I had to move locations because there was some chitter chatter going on, so I had to kind of move around. So please forgive me and all of my moving around. So thank you for that. I appreciate it. I am super excited about this panel. I know we've worked together in the past, and you guys do amazing work. So Dr. Mullins, I know prior to me doing the introductions, you were talking about some of the structural racism that occurs in healthcare and the things as it relates to people speaking out. What advice would you give individuals who may not know how to advocate for themselves? Because there's some people like myself, I'm very outspoken and I'm going to push the needle, but how about those people who may not know how to advocate for themselves and that they're having these issues and that they're going to the doctor and they're being told something different? What would you recommend to them to be able to help them advocate better for themselves?
Well, I think the most important piece of advice I can give is just to stay persistent, to keep speaking out about what it is that you're experiencing until you find someone that listens. And I do want to say that I advocate a lot to my patients about finding a solid primary care doctor. Whether your preference is a male or female doctor, or obviously a doctor, a person of color, make sure you seek that out. It's not wrong to do that, because really that is the person you establish your first relationship with when it comes to sort of the any touch point into your medical issues, as you're a good solid primary care doctor, and that person you develop a relationship with. And so for a lot of people, it is the first point of contact. Too often, what we find is that people come in to the hospital, and they're very sick, they're having a heart attack or they're having chest pain, and they haven't seen a primary care doctor in years, or at all, or their care has been very fragmented because they're visiting the emergency rooms a lot. And I understand that oftentimes is because they feel like it's an emergency, they need to talk to someone and they want care now, but it's very difficult to coordinate that kind of care. So I think my biggest piece of advice, besides making sure that you just keep speaking up, is that you seek out a really solid foundation of primary care so that you have someone to go to first, who understands your health and your risk factors, and is keeping up with you, or helping you to keep up on just preventative care and those sorts of things.
Thank you. I
Mhm.
appreciate that, because I think for me, I work with women and children and their babies, and conducting focus groups in the community. I hear a lot of times, a lot of women, not all, do not know how to advocate for themselves. What I find interesting is that they would advocate for that baby, with taking
Mhm.
that baby to the pediatrician, but not giving themselves that much love and grace to be able to talk to their, OB about the issues that they're experiencing during pregnancy. So thank you for that. I truly
Mhm.
appreciate it.
Very welcome.
So my next question is going to go to Miss Deanna. Um, how early should individuals start getting
Okay, I think Dr. Kring, I'll finish the question. And I think she was going to ask, how early should individuals start getting screened for heart-related conditions, and what tests are most important?
So early is never too early. Quite frankly, when we're looking at any type of health disparity, or any whether it be socioeconomic or ethnicity, we really want to consider getting health screenings as early as necessary. Necessary meaning as long as we can breathe and walk and function, we should be getting health screenings. So I know one of the major factors with a lot of the patients that I've cared for is that we at times escalate a situation. For instance, when I worked in the CVICU, there was a gentleman in particular who had very mild symptoms of cardiac issues, not the excruciating, crushing chest pain as some may think, but because he had a family history, the doctors, sent him off for testing right away. So some of those tests may involve a simple blood test, maybe checking calcium levels, maybe checking if you are actively having chest issues, angina, pain, discomfort, shortness of breath. They may, check D-dimers to make sure you don't have any particular blood clot or something like that, or troponin levels, which would indicate that cardiac enzymes are being given off based on the distress. So really is one, knowing some of your risk factors early on, getting tested as early as possible, but also not neglecting our just routine care, because quite frankly, some of us don't go to the doctor until there's something wrong. Even as a healthcare provider, we tend to just not go to the doctor because we feel like we're going to self-treat. So quite frankly, it's important for all of us to, get those screenings as early as possible. Try to know our family history. I mean, I've encountered patients that maybe they're adopted, they don't know their family history per se. And so sometimes it's, even knowing that is empowering so that the doctor can run proper tests, maybe just based on our risk factors according to genetics, et cetera.
Thank you, Deanna.
You're welcome.
Our next question, I am going to ask Maurice. And I'm going to ask you, Maurice, what lifestyle changes can significantly reduce the risk of heart disease? So if you could speak to how, you have Motown Fitness, you're getting people active and moving, and how that, positively, impacts their health. But also, if you would like to share any of your personal experience too, as well, with physical activity and how that's affected your heart health.
Yes. I think the easy answer, and I think everyone on this panel agree with me, decrease those calories and increase the exercise, right? The less the less calories we're intaking and the more exercise, and we're using some of those calories by exercising based on what the recommended levels are. 30 minutes of aerobic exercise weekly and 2 times a week doing some kind of strength training. I think those are really the best ways to help, with heart health. And then myself, I've been training since 2020, and had lost a significant amount of weight, got in really good shape where I could run a couple miles, and I'm not recommending people try to get to that level, but decrease those calories that you're eating and increase the usage of those calories by exercise. And I think that's the easiest, simplest way. And, in 2023, in January, I actually had a mild heart attack myself. You talk about those troponin levels. I never heard that word until then, but those troponin levels was high. I was in the hospital for a couple of days. They checked me out, and, they suspected maybe there was some kind of blockage in one of the, the vein, the arteries or whatever, temporary blockage, which caused that because I was experiencing some, hey, what's going on? Something wrong. And, have been on some medication and things like that. I definitely had, family history. My father, he died at the age of 46 from a cardiac arrest. And then, I have an older brother, his oldest son, who died at 44 from a heart attack. The thing that gives me hope is that neither one of those gentlemen, really calories, intake and exercise, they didn't do those things to take care of themselves. So, I know for myself, to give myself the best chances to, practice those different things, working out often and, being a trainer and things like that. I'm the people come to when they need some motivation. I tell you, if you ever came to one of my sessions, not only I'm going to work you, but you also can get some mental motivation by me talking. And, I know a little about a lot, I feel like. So, that helps with stress, decreasing stress. And I do boxing fitness. The boxing really helps with not only you getting that physical work, but also the mind as well, right? Remembering combinations, using your memory, using the tools that we need to functional tools that we have every day. So that would be my answer. Thank you, Ashley.
No problem. Thank you, Maurice. And thank you for sharing your personal story. So appreciate it. And so now to tie, because, we know that stress is a leading factor of heart disease and heart-related complications. Can you all speak to maybe what you are seeing when you're interacting with whether it's the community, family, friends, coworkers? How do you think people can really understand that, hey, their stress is really related to their heart? So what are some ways that you help people do, whether it's practice self-care, refer them to a therapist? How can we talk to people who might not understand that them being stressed out and all of that truly is impacting themselves on a physical level too as well? And Dr. Hardy, I see you come off mute, so I'll let you go first.
I was just going to add, I want to say maybe 2 or 3 years ago now, we actually added, we used to be Life Simple 7. So we had 7 things that you worked on. And then around 2 or 3 years ago, we added an 8th, which was sleep health and really focusing on your sleep. And it has been all the rage. Well, I think it's just really cool to talk about sleep because we really don't talk about how much quality sleep really impacts our entire wellness, like journey from skin to hair to your heart, of course, and everything in between. So that has been really what I've been focusing on, but of course, because it's one of our newest of Life's Essential 8, but also if you really think about like how well you sleep every night and like trying to get good sleep, we think about how much our body changes and how we're able to then react. And so getting 7 to 9 hours, and I know every time I say that, people are like, are you absolutely insane? But I'm like, if you try to strive to get 7 first and then potentially get 9, some of the myths I like to just say, you cannot make up for sleep on the weekends. It does not exist. It's not a thing. And napping is okay, but consistent sleep is better. So I remember a couple of years ago, someone put out an article. No, the published article said naps are not as good for your cardiovascular health. What was put on the news ended up being naps are killing us, because you know how a study will come out and then it'll say something different. Naps are okay, but getting quality sleep, getting your REM sleep, getting deep sleep is better. So that's been one way that we have been really focusing on. And the last thing is like figuring out how to get sleep health, talking to your primary care doctor about it. When you bring those conversations up, you can then they can refer you if you do think you need additional help to go to a sleep doctor. So yeah, just wanted to add, I love sleep.
Thank you, Dr. Hardy. And then anyone else want to jump in about ways to navigate stress, or how you maybe signs you see someone like, hey, I noticed you look stressed out. What are your techniques? And Deanna, I see you came off mute. So
yes, thank you. One of the things for me, especially, I juggle a lot with my massage therapy and nursing. So at times they do conflict in terms of, the modality that you use to treat a situation. So for me, the go-to is to recommend a massage, but also even something a little bit more simple without even having a cost involved is deep breathing. So I kind of do like a 4-count breathing technique myself. Like I take a 4-count breath in, I hold it for 4 counts, then I release it for 4 counts, and then kind of start that process all over. So whether I'm driving, if it's dealing with someone difficult or just feeling that internal anxiety sometimes that we have, that's always a recommendation that I try to give to others and implement myself. So thank you.
Yeah, and to piggyback off of that, I have this device here. I've kind of seen these. I don't know if y'all seen these being promoted a lot. So essentially, it has a turn knob here, and basically it can increase the intensity of your breathing. So basically helping you to breathe deeper and things of that nature. And I find this to be really helpful in helping to increase your lung capacity, which in turn can, assist with your heart health. So, it's basically just a breathing mechanism you just put in your mouth. It's more like that. And then you would just, do some patterns of breathing, deep breathing in and out with it. That will help. It can help increase your lung capacity. So that's just something to back off of that.
What is it called again, Maurice? And where can people get it?
Amazon.
Okay.
I was just, I don't know this particular model, but I would type in a breathing mouthpiece, and this would pop right up. And I mean, they're not very expensive either. But I would recommend this to help with increasing your breathing capacity.
Awesome, thank you.
And then, training. I mean, hiring a personal trainer. A lot of people I see don't have the motivation to work out. They don't. And sometimes when you're spending your money and you pay somebody to help you with something to make you show up and things like that, I think that's a good thing. And I'm gonna be there. If you pay me, I'm gonna be there. You're gonna come, I'm gonna be right there. I'm gonna greet you. I'm gonna get ready. We're gonna stretch. We're gonna do the things. So hiring a personal trainer. I mean, we spend a lot of money on things, right? We spend a lot of money on nails. Well, I don't, but we spend a lot of money on things. And, you know, I think, yeah, there's some reasonable trainers in Cincinnati. You know, in other cities, training can be expensive, but I think there's some reasonable trainers here in the city. And I would recommend hiring somebody to help you, you know, get some of that resistance training, get some of that aerobic training in. I promise you, it'll do you wonders. So that's what I'll add.
Thanks, Maurice. And then Dr. Mullins, did you want to add anything?
I did. I just want to say, like, spending more time with people. I think, you know, like during COVID, it was so easy to isolate. And even post COVID, people kind of came back outside a little bit, but it's very easy to turn back inward, especially when we're not feeling good about what's going on. We just kind of tend to go in and away from people. So I think it's just important to make sure that you are getting human contact and, you know, conversation and just experiencing that connection with other people. That can be a big stress reliever. I mean, even if it's not people that you know, but just getting out and going to a park where there are other people around, it's a different kind of experience, and it does wonders for your heart and for your stress level.
Thank you so much, Dr. Mullins. I'll turn it over to Dr. Kern.
Thank you, everyone. I am so sorry. I had some technical difficulties, but luckily Ashley is Johnny on the spot, and she jumped right in to help me out. But I've been listening for the past question, and I know we talked about the importance of sleep. And I think to your point, Dr. Hardy, I think people don't really recognize how important sleep is and what it does in the body as you're sleeping, how the cells and things are rejuvenating and restoring. And I think a lot of times we poo-poo that. I know we mentioned deep breathing and massages, and all of these things are great. The question I would pose to you all, and you guys can jump in if you feel the need to answer the question, how about stress? I know exercise definitely helps with stress, but being Black in America, that's just a stress in and of itself. So what would be your recommendations for, I mean, any of you are, Dr. Hardy, Deanna, Dr. Mullins, or Maurice, what would be your recommendations for Black individuals or people of color who may deal with stress on a daily basis and maybe don't have the tools or the skills to be able to deal with that stress? What would you recommend to be able to improve their heart health?
Want me to go first?
Oh, I'm sorry.
I'll go. Well, one, I think it's really important for us to experience joy. I think we don't talk about that enough. I think and I say that because like there's only so much sometimes we can do. Like the stress of society and the world that we live in, we can fight and change all we want, but sometimes we hit walls, and I think we should have happiness and joy. So I always like to start with that because that can help combat the stressors that we don't have as much control over. So one, experience joy. Two, or not in any particular order, seek therapy to really focus on the stress in our lives. Seek therapists. And I will say one thing that I am very proud of our region is just seeing the increase of therapists that look like us in the community. It just brings me so much joy. I was on Facebook today and I saw a Black male therapist, and I was like, I don't even know him, but I'm going to share this. This is exciting. So those would be my two kind of top ones. One, we deserve joy and happiness, and finding that in the spaces that we need. And then also don't be, I think there was a negative stigma for mental health in our community, and often it's people don't feel like they should ask for help. So it's like early and often, and when things are still good, actually going to therapy when you're actually doing well, and staying consistent, and not just when things are really, really hitting the fan. So just those are the two things I would add.
Thank you for that. Anyone else want to add value to that?
I just want to piggyback on the thought that Dr. Nicole Mullins had made in regards to, finding people. Sometimes, we do tend to isolate, or we want to be that strong person, that person that figures it out, that handles it. And some of that has been handed down to us, through generations. But ultimately, finding your tribe, finding people who are going to elevate you, encourage you. A lot of times we're stressed because of the people around us. We take on their stressors, and misery loves company, right? So we're all complaining about the same nothing. So extensionally, like, just making sure we are elevating our minds in a way that's going to help us to grow. Find other people who not only are going through, but have already gone through, so that they can help us through maybe what we are already going through, and being okay with being vulnerable. And that honesty and being willing to share and open up to one another, I think has been very important and helpful for myself.
Anyone else?
Yeah. Go ahead, Dr. Mullins.
I just want to say those were great points. That they both made really great points. Seeking out therapy and connections to other people, people outside of your sort of level of comfort. When you get way too comfortable with what's going on around you, you don't really seek to improve. You're just kind of okay with where you are, and sometimes you just have to accept that just okay is not okay. We need to just constantly seek out ways to be better, work on ourselves, and to really reduce the load and the burden that we carry. We cannot do everything all the time for everyone.
Yeah. Thank you.
And Maurice, you were going to say something. I'm sorry.
Yeah. I would just add, hobbies. What are those hobbies you like to do? A good friend of mine, he's been organizing these spade learnings. Who know how to play spades? Now I know there could be stressful parts of spades, particularly if your partner, does something they ain't supposed to do. But those kind of things, those hobbies, those activities, you participate in those help. And then also, instead of just mindless scrolling on your phone, do some kind of micro learning, right? There's small books. And I like YouTube. I like to watch, informational YouTube things that I'll actually learn something, not just mindlessly scrolling. And, there's a topic I'm interested in. I'll look at it, find a video on YouTube and learn more about it, right? But so I think learning and, looking at, diving into your hobbies. Maybe look at some hobbies you did as a kid that I used to roller skate a lot. And I haven't done that in 15 years, get back into it, Granted, if your bones can handle it, but, those hobbies and learning, being in that learning mode, being a lifelong learner. I think those are some ways as well.
Yeah, and I would agree with each and every one of you. I think, to your point about, self-care and really having the whatever with the hobbies or the things that you like to do, like what are those things that you do when you're trying to unwind and just to be totally free, and being able to do some of those things to reduce stress. Because I know in the Black population, Black and brown, very high stress, and then how do we manage that stress? And I think a lot of times we're not really effectively told how to manage, but I do believe it's an individualized process. And I tell everybody, for me, I love some good old ratchet reality TV, because I'm going to have a good old kiki and I'm going to laugh and yell at the TV, even though I know it's not real reality, but it's just something that I do to really take my mind off of all of the other things that I have to do in my life. So thank you for that. I appreciate that. So let's talk about lifestyle changes. What do you all think about lifestyle changes, and how can they significantly reduce the risk of heart disease? And how can they be realistically adopted in communities facing economic or food access challenges? I'll repeat it again. What lifestyle changes can significantly reduce the risk of heart disease? And how can these be realistically adopted in communities facing economic or food access challenges?
I think a small change, which probably is pretty impactful, that Maurice mentioned, is putting our phones down. Not spending so much time mindlessly scrolling, and just utilize what you have around you. Cincinnati has a lot of really good parks and outdoor access, that is probably pretty underrated, and it's free. So just to get out and get moving, moving your body, like we talked about earlier, just walking around, getting outdoors. It hasn't really been that kind of weather. And so unfortunately, there are those parts of the year where we're just stuck inside because of where we live. But um, you would be surprised at how much activity can lower your blood pressure. Just spending 30 minutes doing something to get your heart rate up can bring your blood pressure down by 10 points. And so if you're talking about what can I do when I don't have a lot, just walking, getting out and walking if you can't walk in your community because it's not safe, because there is not maybe there's just, it's a concrete jungle and you don't have that green space available. Can you get out and go to another community? Is there someplace close that you can go? There's again, as I mentioned, a ton of parks around here that we have access to. And so your biggest barrier and the thing that you can help yourself the most when it comes to your heart, besides, what you eat, is what you make your body do. And the more we sit and scroll and the less we get up and move in some way, the worse off we'll find ourselves.
Yeah. And to add on to that, I mean, not only is moving your body, exercise good for heart health, but it also lessens the risk of developing diabetes, which we know, your good people at the American Diabetes Association will tell you, we need to lessen that risk as well. So it's a compounding amount of things that it can help lessen the risk of. So, yeah.
I'll add, I'm sorry, Maurice, were you done?
Yes.
Okay. My bad. I didn't mean to cut you off. Reading nutrition labels is probably one of my favorite ones to tell everyone, because we all go buy food, and if you're not getting it from the produce section, what are you putting in your body, right? Like, if we're buying things, starting to look at the labels, if you start to look at the sodium that is in so many of our processed foods, it will change your life. Trust me. Thinking about the things that we buy and the amount of sodium that we intake from them. And then also, even though I will say myself, I do not love to cook, it just doesn't bring me joy. I do it in order to eat. And I hate the cleanup process. Anyway, I don't love it, but I can control what I cook. I could control the sodium. I could control all those aspects. And when I eat out, I'm not in control, right? When I get takeout, when I get other people's food, I don't know really how much sodium is making it probably taste so amazing, right? So thinking about how do we make nutritious meals at home? And then if we are making processed foods, what does that look like? And how are we looking at maybe two different things and saying, oh, I'm picking this one because it has less sodium and other nutrients that we actually want to fill our body. So that's often when I tell people first thing. It's like, you can control what you can control, and let's look at low sodium options and limited sugar, no added sugar, to Maurice's point as well.
And I think those are both great points, because I think back in the day, I used to do diabetes in pregnancy with pregnant women, and I learned a ton about diabetes, and I worked with an amazing dietitian. And one of the things that I think some women from our community, they were kind of poo-pooing like some of the foods that she would want them to eat. And what she did was she actually came and actually cooked low-cost meals, tons of flavor for the women, and let them try it. And it changed their life. Right? Because it's not something that I know that my family cooked. However, if it's definitely low in sugar and low in sodium, and it is good for my diabetes, being able to demonstrate and let individuals taste certain foods, so that way it may not be, Big Mama's collard greens, right? But it could be another version of it to be able to make it healthier for you. So I do appreciate that as far as the dietary changes and reading those labels, which I think is really important. Now, Maurice, you got a question? I see you making a
question. Speaking of the greens, I don't know if this is something that's happened over the last 20 years or what. Well, do people put ham in greens anymore? I feel like everybody put turkey now. Everybody.
I do turkey, but what about y'all?
Turkey.
Smoked turkey.
It's a switch.
So it's a good switch.
It's a good switch. Yeah, there you go.
They both smoke, so they're probably both high in sodium. I just won't lie. So I'm just asking, just saying it's probably better if you actually do vegetarian greens. I'm just saying.
No, but you know what? I appreciate that though, because I'm thinking I'm good with my little smoked turkey, but you're right, it is higher in sodium.
Yeah. I'm not saying you can't do it. It's just like you smoke it, right? Turkeys or greens do you want to eat in one? So.
And that's a good point. I think just start slowly, make subtle changes, because it is difficult to jump from, okay, my mac and cheese with the 3 cheeses or 6 cheeses, let me cut down to 3 cheeses, whatever the case may be. But ideally, just making those small incremental changes and shopping the perimeter of the store, because that's where the less sodium, less processed foods are.
I think that's excellent, Deanna, because I feel like you're right, though. I think sometimes people expect that they're going to have to make these overnight changes as it relates to my diet. Like, I'm not giving up my Pepsi. I know I spoke at a church group about diabetes to some older women. And when they first came in, they weren't giving up their Pepsi. They were drinking 20 ounces a day. And they were adamant about not stopping their Pepsi. But by the time the class was over and all the things we taught them, that one particular woman, over the course of that 6-week class, she was done. She said she didn't even have a taste for it. So I think that's an excellent point. Being able to educate people that you don't have to start perfect tomorrow. What's one small thing you can do to move the needle forward and continue to work on that? Whether you're losing weight, whether you're going to school, or whatever the things are, it's taking that one small step and moving forward. So that's excellent. With going from 6 cheese mac and cheese, because I know it's good, to the 3 cheese. So especially Big Mama's mac and cheese. Yeah, Maurice.
So now I don't know if people know this. So, I like garlic pepper, right? But if you look, garlic pepper, most of them have salt in them. But there's one place that sells a garlic pepper that doesn't have salt. Dollar General. If y'all hear me, Dollar General's garlic pepper does not have salt in it, and I buy it all the time. Dollar General salt, garlic pepper. And that's what I go. That's what I do. So that's one of the little small changes I made, because most of them have salt in it. I'm like, man, how does garlic pepper have salt in it? That one don't though. Or you can mix, yourself. But
I'm curious, Maurice, what you put this garlic pepper on?
Most of the things.
Everything.
Yeah, really. Yeah.
I gotta get you. So you said Dollar General. You said
Dollar General.
Okay.
Yep.
I'll definitely try it.
I see a lot of patients. So almost all the patients that I see have had surgery. A lot of them have bypass surgery. That's like the number one thing that we do. And the one conversation I try to have with everyone before I send them out the door is that this change that they're about to make, because most of the time, if there's a spouse, a lot of it is fear that this can happen again. And so they're like, oh, I went home and I got rid of everything. No more salt, no more this, no more that. And, the patients, they have just this look on their face. It's like, oh my God, like nothing is going to taste good ever again. But you talking about the garlic pepper, and like you found that as something that you like to put on everything. It is, you're right. It's small things that you can like incorporate into your lifestyle, and just doing it little bit by little bit versus a very like cold turkey sort of I'm getting rid of everything, makes it easier to sustain. And then you embrace it more, because then you start getting curious, like what else can I find, what other ways can I reduce salt, reduce sugar in my diet, reduce the fat, like what is on the outside of the store. So it just it really is, and that's grace, right? Just giving ourselves grace to like, okay, this is not the end because I've had surgery. In fact, it's the beginning of a new lifestyle that we're going to start working on.
Dr. Mullins, I appreciate that, because I feel like, what Marie says, like each one teach one, right? Because sometimes you may not have an experience with it, but because Marie said he loves this garlic pepper, I'm going to go get some and just try it. And then and let me just play with it and see, like, well, maybe I can put it in this. And then being able to say, well, this is my staple, and me telling someone else, and then they're telling someone else. That word of mouth is how we do that. So thank you for that. I appreciate that. And I know we have about 11 minutes left, but I want to talk about culture and community perspective for our last few minutes. And this is really important to me because I know in the Black community, for a variety of reasons, we have a lot of cultural stigmas around seeking medical help and mental health support in the Black community. Let's talk about how do we break down cultural stigmas around seeking medical help and mental health support within the Black community, especially when people are diagnosed with a health condition, whether it's diabetes or high blood pressure. They tend to feel like I'm weak, or like I'm not going to tell anybody because I don't want to be seen as weak, or or maybe putting their head in the sand and not dealing with whatever they're dealing with. How do we break that down and have people recognize the importance of our bodies and the health of our bodies?
I've lost so many family members because they've done this very thing where they didn't, they did not, they were the stigmas, right? And there's one who was having some heart issues, just didn't really tell anybody about it. Just kind of kept moving on, and like, you okay? Yeah, I'm fine. And now they're really struggling. And I see that too often. And for me, I try to share some successes or some things that I've read about people, and why, or some different advances, different things like that. So I try to share, hey, this is what success will look like if you do go get checked up. It's not the it's just, or if you had this diagnosis, doesn't mean it's the end of the world. And many that know me know that I have a little brother who is really fighting for his life. He's been doing so the past couple of years, and he actually had a ruptured aorta. And an example with him, sorry brother, I'm sure you're okay if I share this, but part of his challenge was he didn't go to the doctor, and then at late 30s, he started having some issues. He thought it was okay. I'm just going to continue to work out. Next thing you know, his aorta ruptures, and he almost died. By the grace of God, I was there and was able to call the ambulance to get him to the hospital and see what was going on. And if you know about ruptured aortas, 20% of people even survive that. So, that's one of those things. Is like, hey, start getting that checkup, start going to the doctor, and then speak to medical professionals. Don't speak to Facebook. The other day I seen this post about someone saying Black people shouldn't take lisinopril, and I'm like, hey, first off, talk to the medical professionals. Don't listen to these people on Facebook. Yeah, Black folks have higher rates of you got a higher chance of getting angioedema from taking lisinopril blood pressure medicine, but the blood pressure medicine is to help keep your blood pressure low. And if you need it, it doesn't happen for everybody. So don't listen to Facebook. Talk to those medical professionals. Go to the doctor. They got medical degrees. They got nursing degrees. They got these degrees for a reason. Go talk to them, not Facebook.
Can I just add to that? Because I saw that same post and I thought it was just me that saw it. So now I'm like, this was really viral, and I could not believe that
Can we talk about that a little bit? Let's talk about it a little bit.
I was just so mad because I'm like, who is this? And they put the photo of the prescription, so then it gets more traction. I mean, there were thousands and thousands of people on this post talking about not taking a drug because I think they said it hurt them in some way. And then people were commenting under it too. And nobody was a doctor. I should have reported it. That's what we need to do, Maurice. That's what we're going to do. That's what I'm going to do next time I see some crazy stuff like that. I'm going to report it because that is the problem. That's what
misinformation.
Mm-hmm. Yeah, that's misinformation. Yeah. Sorry. I know you were going, Dr. Mullins. I just was like, I saw that same post and I was flabbergasted. I'm like, who are y'all? And why would you tell people not to take their medication?
Right.
Yeah, I think that's perfect. That's exactly correct. First of all, you can run, but you can't hide from these things. They're going to find you. And when they do, it's usually even worse than if you had just faced it from the beginning. But the other thing that I like to say is that I put my organization on notice, like we need more Black providers. in the primary care setting and the specialty setting, because part of the reason these stigmas and so forth exist is because people don't feel like they can come into these places and they're going to be understood. So if we increase the number of providers of color, then we by nature are welcoming people of color in. They feel more comfortable, and then they will seek out information from reputable sources, not just Dr. Google or Dr. Facebook or Dr. what's his name that was putting out all that information about health and supplements and stuff. I forgot that guy's name, but there's so much misinformation out there, and there's so much access to it because everyone's got a phone. But if we can really just work within our organizations to advocate for more providers of color, and then also remind people that no matter what, they just have to go in. They have to go in and take care of themselves.
Yeah, I don't want to disappoint some people, but these people talking this Dr. Sebi stuff, I just be like, oh.
Yes, that's right. That's the name.
Sorry if you're a Dr. Sebi fan, I'm sorry, but whoa, that's all I gotta say.
Absolutely, and I appreciate that, because I think all of that has value, because I believe that in this society, to your point with social media and Facebook, and everyone has these ideas and saying, well, I took it and it did this. What people are not realizing is that that's how it acts in their body. It doesn't mean it's going to act that way in your body, because we're all very, very different, right? So being able to, not spread that misinformation is super helpful, because it adds to the myth and the pushing us further back than pushing us forward. And then I have one last question. And I got so many good questions, and I didn't get a chance to get them because this technology issue I had, but I'm sorry, charge it to my head and not my heart. But the one thing I want to talk to you all about, or giving advice to the audience here, how can healthcare providers build better trust with Black patients to encourage proactive heart health management?
Show up.
Listen.
See where these people are going. See where any community events. Be there. Be there every time.
Yes.
Every time.
Yes, that's correct. Be present. All you can do is use your voice. You know so much, and you tell it to your patients every single day. But honestly, you can never say some of these things enough, because sometimes some people will never hear it if they didn't hear it at a church event or at a community health fair, or at something like this where they tuned in.
I'll add, and Maurice has shared his story, and I remember the first time he actually said it in a public setting. We had him at an American Heart Association event, and the amount of people I know that went and made their doctor's appointment after hearing Maurice speak. And that's what happens, right? It's that hearing that trusted voice, and then going to your primary care, but also being somewhere that someone is going to listen. So they need to actively listen. And if they're not listening to you, get a new provider.
Yes.
And you have the ability to do that, and go to someone that you feel will listen to you, all your concerns. Mm-hmm. And tell you to get your life together. Because I need a little, Maurice was talking about motivation. I do have to pay people to tell me, because I'm a little hard-headed, and someone have to tell me to get my life together. Okay. I know myself, and I need all accountability in every place in my life. I need everybody to keep me accountable, because, I just want to have a good time. So, have an accountable physician that'll say, hey, this isn't looking right. You need to get yourself together. Have a personal trainer, have all of those things. Have your massage therapist that's going to tell you need to relax and come in here and get your self-care on. So all of those aspects of your life are important.
Oh, and make sure your provider, your primary care doctor, stays up on latest research. Not everybody does that, surprisingly.
Mm-hmm.
Everyone is not open to understanding that some people are people, and they, just because they're doctors doesn't mean they can't get stuck in their ways. So it's important that that person is talking to you about, well, here's what's the latest research. Here's what we are doing out here now, or what's being suggested.
Agreed.
And I would lastly add to that, I think I agree with everything what everyone said. I think listening, and I also say listen to understand, listen to, not to respond, listen to understand. because as providers, you have this unique skill set to help the community, and it may not be your life experience, some of the stress or the way men feel or the way women feel, but listen to understand and try to dig deeper to understand why is it this way. Like for Dr. Angelica, she says she hard-headed, so am I. Very hard-headed, but sometimes just even understanding like what's my motivation and reaching me there versus checking the box and going to the next patient, looking at the patient very holistically and understanding kind of what they're going through and what they're feeling to be able to meet them in those areas and fill the gap in. I tell every person I work with, you know, I'm going to meet you where you are, but I'm going to take you where I want you to go. But we're going to go hand in hand. It's not going to be my way. It's going to be collectively me respecting your wishes, but then also being able to help you through to the next phase of your life. So I thank you. Any last thoughts? I know we're at time. I wish we had more time because this is an amazing panel. Any last thoughts for our viewers?
Yes, I have something.
Maurice.
The silent heart attack. We don't necessarily talk about that a lot, but that's you basically having a very mild, a heart attack that you don't even realize is a heart attack. You might think, oh, my chest hurt and things like that. Pay attention to those things. And, you know, I'm reading as well that the only way they can really tell someone's had a silent heart attack is by imaging, by electrocardiogram, or, you know, things of that nature. So, you know, if there's been times where you had these mild chest pains, or, you know, feel like a heartburn or something like that, yeah. Might not be the shortness of breath, might not be the chest pain, the direct chest pain, but you notice stuff like that, pay attention. You know, tell your doctor about it, and you know, get those EKGs, get those different things to test for that.
And I just want to add briefly also, like, we don't have to accept everything that's been handed down. Meaning if grandma had diabetes, that don't mean we gonna have it. If, you know, oh, she had sugar, oh, she had, a lot of our risk factors are preventable. So please get checked. Please know your risk factors, but also be proactive, people.
Good point. Get outside. Yes, it was nice today. There are many more of these days to come. Take advantage of them. You know, this you can sit inside and stare at your phone. You can sit inside and stare at this news stream, which is just every day, just more unbelievable. Or you can just kind of put it out and get 30 minutes of sunshine and vitamin D.
I have nothing to add. They did it all.
Well, thank you so much, panel.
This is outstanding.
Yeah.
I truly appreciate each and every one of you. I wish I had more time for more questions because I wasn't going to get to some nitty gritty, but this was amazing. I loved it. I apologize again for my technical difficulties, but thank you so much from the bottom of my heart. And Black Women Cultivating Change. Thank you so much and have an amazing evening.
Thank you.
Thank you. Thank you.